Unfortunately, I don't have anybody to record a video with because I haven't been around people this week, but I'm going to pretend that this stuffed animal is my patient. And today we're going to talk about chemotherapy, radiation, and some drugs that they would be put on and the side effects. So when doing patient education, I would of course walk into the room and I would introduce myself, perform hand hygiene, and then talk to my patient. So when talking about chemo and stuff, it's a very sensitive topic, so you want to make sure to use therapeutic communication because the patient's probably very upset that they're going through chemo and stuff like that. So I would want to make sure to tell my patient that everybody who goes through chemo will experience it differently, and just because you read or hear things of people going through either really good treatments or they have like the worst experience, that it could vary per person, and just to give them an overview of everything that they could expect so that they're aware that they may experience certain things. So I'd also let them know that their provider is going to be giving them their specific plan of chemotherapy and their regimen, but I'm here to review the medications, the side effects, give support, and just information about what to expect while getting chemo and radiation. So I'd also tell the patient, you're welcome to bring family members, a support system, friends to your chemotherapy to give you encouragement, to help distract you and just make the experience as best as it could possibly be, to never be afraid to ask us questions throughout this education or throughout your chemotherapy sessions as well. So for this patient, it looks like they'll be receiving radiation before chemotherapy. So I'd want to point out that chemo is going to be used as an adjunct treatment to the radiation, and the radiation's purpose will be to try and shrink the tumors so that the chemo could come in then and try and kill away all the rest of the cancer cells. So basically just the radiation is going to try and reduce its size, and then the chemotherapy will be used as another measure to try and take the cancer away. So while you're going through radiation, some things to just keep note of. You want to avoid or even just reduce some of these things, so sodium and added sugars, solid saturated fats, and alcohol. You would also probably experience some fatigue or skin changes, and hair loss would also be possible. Because some of these things include your diet, you could also get in contact with a nutritionist that we can provide for you so that you could kind of make up a diet regimen to follow to help while you go through your radiation. So in terms of your chemo, the drugs that you'll be receiving are melphalan and cytarabine. And these drugs will both be given through IV. You'll actually be getting a port that your provider has told you about, so I'm going to just explain that a little bit more. So an infusion port is a device that they put beneath the skin, and it's attached directly to a vein. This will prevent you to have constantly being injected with a catheter every time you come, and it'll help, with bruising and stuff, because it'll just be a one-time procedure, and then you could always access the port, and then down the line it could be removed. So it won't cause you any pain once it's placed. You could feel it underneath the skin, but it won't hurt you. And so the way that works is that the needle's put into the port so that the medication can be delivered throughout your body more easily. So if you are going to continue working while you're going to receive chemo, just know that you'll probably be very tired, and if you can try and schedule your treatments in the later afternoons or right before the weekend so that you'll have enough time to rest, that would be great. And also having a family member or friend, even if you need to take a taxi or something, to someone to drop you off and pick you up, just because you will be really tired, and you can maybe feel some nausea, so you wouldn't want that to interfere with your safety while you drive. Um, Going back to nutrition and stuff, if you find it easier to meal prep once when you have a lot of energy in the beginning of the week, so throughout the week you don't have to worry about cooking, because you still want to make sure that you're giving your body all the nutrients that it needs. A lot of the side effects, most common side effects with chemo drugs could be a loss of appetite, but you want to make sure that you're still giving your body as much nutrients as you can. And even if you yourself or you don't have anybody to help like assist cooking with, you could also get into programs that they deliver meals to your house, or just anywhere in your neighborhood that does like a type of meal prepping. We can help you get in contact with if you need. So post 48 hours after your chemo treatments, sometimes that there could be chemo in low doses in your urine or your vomit, other type of bodily fluids. So you want to take really great safety precautions when excreting things or doing laundry, especially if you live with others, because their safety is also a priority as well as yours. So going now into the drugs that you'll be receiving, your melphalan, you'll be receiving this through your port, and it's classified as an alkylating drug. So I'm just going to go over some of the side effects now that you may experience, and if you have any questions along the way, of course you can stop me. So low blood count, this could be a side effect that a lot of patients have, and this could just put you at risk mainly, especially for increased risk of infection, because those white blood cells are also going to be suppressed in your body because of the chemo. But we'll talk about safety precautions and how to protect yourself from infection in a little bit. So nausea and vomiting, if you were to have an allergic reaction, that would be considered the side effect. Any mouth sores, diarrhea, loss of fertility, and hair loss is possible. So now to your second drug is going to be cytobarine. It's also going to be through your port as well, and this is classified as an anti-metabolite. So some side effects again would be the low blood count, because you're taking two drugs that would put you at risk for low blood count. You are going to be very immunocompromised, so that's something to keep in mind. Headaches, nausea, vomiting, mouth sores again, that loss of appetite, skin rash, and hair loss is also possible. So because you're going to be immunocompromised, you want to contact us immediately if you have a fever of 100.4 or above, if you're experiencing any chills, because this could all indicate infection. If you have any chest pain, heart palpitations, or if you find it hard to pass urine, those are other key indications that you want to call us immediately. 911, and it doesn't matter if it's in the middle of the night or early, in the day. Don't hesitate to call because it's serious. So again, you're going to be at a greater risk from infection because you are receiving chemo and you've had radiation. So you want to just avoid people who have like a cold or are sick at that time. You want to make sure that you yourself performs hand hygiene, and those who come visit you and your family members are really conscious of also washing their hands, covering their mouth when they cough, and the elbow when they sneeze. I'd encourage you to stay away from large crowds because it's easier to catch an infection when there's a large group of people. You don't know what anybody has, so it's important that you just make sure that you really are conscious of your safety because you are at a greater risk for infection. And I can give you some pamphlets and stuff that have your medications listed, some of the information that we went over. There's also support groups for other patients who are going through similar things as you. Feel free to reach out to those. I know it could be overwhelming, and if you have any questions, you could always contact your provider or contact your nurses. So yeah, thank you.